Hello, if you've ever wondered why you actually go to the dentist, besides doing the routine thing, besides because everyone else is doing it, so maybe you should think that you should do it too. This podcast is specifically going to address the average dental visit and it's going to address the common complaints that majority of people actually do. And then there's a funny video that one of my very good friends shared with me on Instagram, and hopefully it's going to work here. So let's get started. By the way, today is episode number 68 on the Discover with Spinetti podcast. If you haven't seen the other podcasts, make sure you check them out. They're all uploaded on YouTube, but they're uploaded everywhere else. Facebook, X, you name it, it's there. Let's get crack-a-lackin'. So this is the video. I'm going to put it on. I hope you can hear it.
I mean, I need to know the work you want to do before you do it. We'll just do a bunch of stuff and then charge you for it. Bite wing, both sides.
So if you cannot,
So,
I
we
came
finally
a
got
little
you in
bit
here.
prepared.
Your
I mean, I
office
tried
keeps
to test
calling and
different
texting
things.
me. It's been 6 months since
But
your last appointment. So what? You need regular checkups and
It's
cleans.
hilarious.
Says who?
Okay, so
Me.
it's a
Let's
skit
get some
by
schmackle
this
pics.
very funny
Your dental
guy
health is important.
who
My teeth
basically
feel fine. That doesn't mean everything. Let's have a
gives
look.
you
Just so you know, I don't have insurance.
a
So we'll treat
glimpse
you worse
as
and bill you
to
directly.
a
I mean, I
typical
need to know the
dental
work you
visit,
want
a
to do
typical
before you
dental
do it.
visit,
We'll just
but
do
a
a
lot
bunch
of
of stuff and then
humor
charge you for it.
put
Bite
in.
wing, both sides.
And
I don't
I'm
want to
gonna
pay for any
address it. I
unnecessary
really wish that
x-rays.
you could
We have
hear
to know
the
what's going on
sound,
inside
so
your
maybe you
teeth. It
can't.
helps us do our job. My teeth feel
No
fine.
worries.
Yeah.
I got it covered. So you can see here where it says, I'm just going to remove my face. It's at Brian Herzog. So if you go to at Brian Herzog on Instagram, you can actually see the video. It's hilarious. It's actually very, very funny. It's very funny. And so this is what this podcast is about. So that's what I'm going to
Risk
be
it.
addressing.
Might cost you a lot more later.
And
Let's do a
hopefully
panoramic
you
and a
can hear it,
cephalometric as
but
well.
you can't. So we're gonna get rolling. So one of the things that he mentions in the video is that that the dental offices keep calling and texting over and over again, and that's why he showed up, because he felt like he had no choice. Well, here's the thing. The reason, there's two reasons. The reason why the dental office calls and texts for you to come in is because, one, you haven't told us that you don't want calls or texts, and two, we care, because the whole point is that we are the guardian of your oral health. So if you come in, now you are our patient. So now we feel responsible for you. Now, if you are busy, because we understand, you get busy, we understand that you forget, we understand that other things come up, and we also understand that the least place that you actually want to go to is the dentist. So we completely understand all these factors, and so that's why we keep texting and calling, so that we can remind you, hey, look, you're overdue. I don't like that word, but you haven't come in for a long time. Bacteria and plaque is building up. You're going to wreak havoc to your gums, bones, and teeth. Come in. So that's the reason why the office calls and texts a lot. But if you tell the office, hey, look, can you please not text or call? I will call whenever I want. Then, I mean, we leave it up to you, but that's to your detriment, because more than likely you're going to leave that to the end, because like I said, the majority of people don't actually like going to the dentist. It's not like the most favorite place to go, unless of course it's Spinetti Dentistry, then it's your favorite place to go. But in all jokes aside, it is actually a very, it's one of those things that people actually fear to go to. So that's why we call and text all the time. Okay. Now, something else that we do, and the reason why we recommend you come in every 6 months, is because plaque builds up at an astounding rate. And the bad thing is that plaque builds on plaque. So if you have plaque that builds up on your teeth, that eventually it'll cause gingivitis and periodontitis, which is gum disease and bone disease. Now, the bad thing is that as soon as it starts building, it becomes easier for other bacteria to build on top of it, because the rough surface of the tooth is what allows it to stick even more. So that's why when you come in for your cleaning every 6 months, what you're doing is that you're causing that, or the hygienist is causing the smoothness to come back, so that the plaque doesn't build easily. Now, if you haven't come in every 6 months and you are, a person who isn't taking care of their oral health on a regular basis, and so now you're actually getting to a point where you're starting to lose attachment. So you're starting to lose these attachments, these fibers, you're starting to lose them. Yes, that happens. You start to lose those attachments and you start losing bone. And now you have to come in even more frequently, because now the chance of you getting more plaque is so much higher than if you were just to come in every 6 months. Now, why is it, do you think, Maybe you don't know. Why is it that a lot of people come in every 9 months or every year as opposed to every 6 months? It has nothing to do with anything except insurance. Now, insurance comes in and says, insurance companies comes in and says, okay, well, we're only going to subsidize 9 months worth of your cleanings. It's got nothing to do with studies. It's got nothing to do with your health. It's got everything to do with the negotiation that they have with the employer that has contracted them in order for them to provide you with the benefit. Otherwise, they wouldn't probably provide you with anything if they could get away with it. So that's why your dentist recommends you come in every 6 months. It is highly recommended you come in every 6 months for a cleaning and a checkup. And I'm about to address this later on. X-rays don't have to be done every 6 months, but I'll come in to that in a second. But I hope you understand now why it is that we recommend. Now, another beneficial thing that we do, not all offices do, but certainly Spinetti Dentistry does, is that we take a scan or an iTero scan or a 3D scan, non-ionizing, so it's not an X-ray, every 6 months in order for us to see as well, if there's any changes to your gums, if you're losing any gums, if your teeth are shifting, if your bite's changing, all of that we can actually see because they overlap. There's this technology, it's called time lapse. It's really cool. It overlaps your scan every time we scan. And so, like if your gums are receding, or we can catch it at that early stage and we can actually counsel you, we can monitor, we can coach properly, but we can only do that if you come in frequently. And that's why we want you to come in every 6 months. I hope now that clarified it. Okay. All right. So that's that. Moving on. Now, one of the things that most people say when the dentist comes in and starts to diagnose things is, my teeth are fine. My teeth are fine. I don't feel anything. My teeth are good. I'm cool. My teeth are good. Well, I mean, you don't want it to get bad. Now, I'm going to show you something. Okay, I'm going to show you something. I'll get back to this. Now, check this out. I showed this before. I showed this on another video before, but I'm going to show it to you again. Now, this here is from a gentleman who had crowding, asymptomatic, which means that he couldn't feel a thing. And I circled it this time. I didn't circle it last time. I circled it this time so that you can see it. I'm going to put my picture up so I can actually talk and you can see it at the same time right here. Okay, so you can see it. If I do this, can you see it? Right. Oh, there we go. Yeah, there you go. So you can see it right here. That works. Okay, you can see the cavity. Now, the cavity wasn't even on the patient's mind or on our mind at all because we couldn't see it. The x-ray covered it. The x-ray covered it because the teeth were overlapping, so we couldn't see the cavity. And the patient was asymptomatic. There was absolutely no way for us to even see it because there was severe crowding. And so because of our counsel, because we advise them that, hey, look, like it's best for you to actually get your teeth straightened, better for your health. We don't know what's going on between the teeth because we can't see it, and so on and so forth. Better for your oral health, gum health, bone health, stuff like that. And then lo and behold, you see this cavity. Now, what happens, do you think, if that wasn't discovered? What do you think if this person wasn't coming in every 6 months, wasn't coming in and wasn't actually diligent about their oral health? What do you think would happen? Well, that would end up to be a root canal because it was soon to be a root canal. It would have been a root canal. But then how do you even access it, right? How do you access it when it's really just hugging all the other teeth? Now you have to destroy the entire tooth. And then how do you put a crown on a tooth that's hugging the other teeth? Do you see the complexities behind it? And that's why we recommend you come in every 6 months. Okay. So now, this is also addresses that my teeth are fine. I'm also going to show you other pictures of what teeth are fine look like that are asymptomatic. Now, I want to address this one. I don't have insurance. When someone comes in and says, I don't have insurance, and says it to me or says it to someone else, says, hey, look, I don't have insurance. I want to tell you, okay, whether or not you have insurance, we are going to diagnose the exact same thing. Diagnosing means we find a problem and we tell you about it. Now, the thing that we do at Spinetti Dentistry is that we just tell you the problem. If you don't care about solving the problem, then we're not going to recommend anything. That's the philosophy at Spinetti Dentistry. We just educate you. We tell you exactly what we're finding. We say what's going to happen if you don't do anything. That's the consequences of not treating the problem. But if you don't do anything, if it doesn't concern you and you say, hey, look, like I understand it's going to be really bad, whatever. I'm cool. I don't want to do anything. I will deal with it when it becomes a nightmare. Fine. We put it in our notes, in your charts rather. We put it in your charts. It's logged in, and that's it. Okay. We don't pressure anybody to do anything. That's the philosophy at Spinetti Dentistry. So whether or not you have insurance, the diagnosis is the exact same. We're going to find the exact same stuff, and we're going to tell you the exact same way, and it becomes up to you whether or not you want to treat it. Now, whether or not you have insurance, that's completely inconsequential, because if you care about your health and you care about things not getting worse, and if our educational system is actually good at Spinetti Dentistry, then you would know that you don't want to get to that stage. And so it's much better for you to actually catch things much earlier on. I need to know the work that you want to do before you do it. Now, the educational system, like I said, every dentist educates their patient. Every hygienist educates their patient before we even do any kind of work. And if we miss something or whatever, then we tell you. But it's a legality. We have to tell you before we treat. We tell and then we treat. Okay. All right. Moving on. So I showed you this one. Now check this one out. Oh, check this one out. I don't want to pay for unnecessary x-rays. I hear this from time to time. I don't hear it all the time, thankfully. The majority of my patients, I'd say over 92%, around there, 92% of my patients, whatever we recommend because of reason, they go ahead and they heed to the recommendation. But some people, they say I don't want x-rays because they fear of the x-rays. Now, here's the thing. X-rays are not something that is routinely done on every single person. It's not. X-rays are done based on something called caries risk. So if you are a high caries risk, meaning that you have a higher potential of getting decay, then it is the recommendation according to the American Institute Association, the Canadian Dental Association, and the Australian Dental Association for you to actually get a certain frequency of x-rays. And the reason is because you have a higher chance of getting cavities. So if we don't do it, by the time you come in the next time, which is, if you're coming in every 9 months because of your insurance, then that's a year and a half that we haven't taken any x-rays. Well, guess what? A lot can happen in a year and a half, especially if you're high caries risk. Now, what determines high caries risk? What determines you to have high caries or high probability of getting cavities? One of the ones is for you to actually have a filling in your mouth that's been done in the past year. Because if you have a filling, that is a magnet for bacteria. It's a magnet. So as soon as you get a filling, it's a magnet. Well, and then you ask yourself, okay, why should I get a filling? Because if you don't get a filling, the cavity is going to get a lot worse. There's a reason why you got in that state. It's because probably you're not flossing properly. Probably you haven't come in every 6 months, hint, hint. Or you haven't, you're not brushing properly, you're not flossing, whatever it is, you haven't given us the opportunity to coach you to actually monitor your health properly so that these things don't happen, right? So as soon as you get to that stage where now you're at high caries risk, it takes a while for you to get out of it. It takes around 2 years for us to not see any evidence of any decay or any progression of any cavities for us to be like, okay, fine, now we're going to lean back to a year. And this is all based on studies. It's not based on our feelings. Okay. You can look it up, Google it, caries risk. Okay. There's a bunch of information you can find on the internet. And I would highly recommend you don't seek any kind of answers from anything than journals. Okay. Then, like, for instance, the Journal of the American Dental Association, JADA, or anything like that is vetted by peer-reviewed, articles. Then I don't recommend you actually seek any kind of other kind of information on the internet, because a lot of things on the internet, unfortunately, are not true or very exaggerated. And a lot of people come into my office and say, I've seen this on the internet. I'm really worried. Is this going to be like this? And 9.9 times out of 10, it's not. Okay. All right. So I hope that clarified this. I don't want to pay for unnecessary x-rays type of deal. Okay. Now, here's a picture. I'm going to put my picture back up. Here's a picture. Oh, no, that's not the one. There you go. Here's a picture. Actually, I think I have it on a magnified. Yeah. There you go. That's a picture. The top one is an x-ray. The bottom is a before and after of me filling the tooth. So it's actually, there you go. You can see it there right here on the bottom. You can see the cavity. Okay. Now this is a zoom in. So this is a zoom in of that picture. Now, this is what a cavity looks like. Now, this, by the way, as it says on the slide, it's asymptomatic, meaning you cannot feel it. So when your dentist tells you, for emphasis, when your dentist tells you you have a cavity, by the way, we don't say we think you have a cavity. We don't say that. A diagnosis is definitive. We say you have a cavity. If we're not sure if you have a cavity, we'll say this looks suspicious, but I can't diagnose it as a cavity. Okay, that's what your dentist would tell you. But something like this, that's a cavity. Okay, now you can see here, there's a color change. The color change is because of the difference in the material of the tooth. Dentin is mainly organic material, meaning it's a different type of material than the enamel, which is inorganic. And that's why as soon as the cavity passes that junction of the enamel dentin junction, then it's like a torpedo straight into your nerve, like a torpedo. Like, have you seen a torpedo? That's how it becomes. So we're trying to prevent that from happening. But once we see that on the x-ray, we're like, look, you're a high caries risk. You have a bunch of these. It's best for us to actually stop it so that it doesn't get worse. Because if it gets worse, then, I mean, things get a lot worse. Now, here's the thing that most people don't really think about is that the bigger the filling. So if you wait for a long period of time, you're like, no, I'll wait. If you wait for a long period of time, you get a bigger filling. The filling's not going to last you as long as a smaller filling, because the smaller the filling, the longer it's going to last. The bigger the filling, the less it's going to last. Meaning now that you've waited and now the cavity's gotten bigger, now you're even like, you're really pounding on yourself. You're really doing yourself a huge disfavor. That's why we recommend you come in every 6 months. Because if you don't come in every 6 months and the cavity gets bigger, guess who's going to suffer? You. You're going to suffer because obviously you're going to say, oh, I don't have insurance. Well, now that you don't have insurance, now the cavity is bigger, meaning the filling's going to get a lot more expensive, meaning now you're going to have to pay a lot more frequently, because now you have to replace the cavity. You have to replace the filling more frequently because now the filling's going to fail because it's bigger. So now you're increasing the cost more and more. It's not a pleasant situation. I understand. It's not. But if you don't actually get it fixed when it's small, it's not going to get any big. It's not going to get any better. It's not going to get any cheaper. So that's why we recommend you go in every 6 months. Heard me? Okay. Now, getting back to this. Now, here's the thing. When people say teeth are feeling fine, it doesn't mean that they are feeling fine. It doesn't mean that they are fine, because cavities, believe it or not, and similarly to actually gum disease and bone disease, it's kind of like having heart disease, right? Heart disease, you don't actually feel heart disease. You don't feel it until it gets really bad, i.e. pre-heart attack, right? As soon as you get something called angina, which like feels like a crushing, they describe it in medical terms as like a crushing, like an elephant is sitting on your chest. That's too late, right? You don't want to get there. You want to prevent that from happening. Same thing with the cavities and the gum disease and the bone disease. And that's why we educate you. That's why we have so much passion when it comes to that. It's got nothing to do with us making money. We're going to make money regardless. Okay? You have to understand, we're going to make money regardless. We're not here to scam you. We're here to tell you. We're here to teach you. We're here to take care of you. Okay? That's the whole point. And here's the evidence. Okay? So I have more evidence, by the way. And as you can see, passion is dripping from my forehead because I hear this thing all the time. All right, now check this out. This is a sign of someone who waited. Okay, they waited for a long period of time. Okay, so they waited for a long period of time, and this is what happened. Okay, you don't want to get to that stage. Okay, you don't want to get to the stage with a here's a prime example. Okay, prime example of a large filling that caused now the tooth to become weak, and now the tooth actually fractured. So you can see on that tooth there, now it requires a crown. Now, luckily, that tooth was savable, but a lot of times, actually, a lot of patients have come in where that fracture was so deep, I had to pull a MacGyver, right? I had to do a herodontics, right? I had to do some kind of heroic maneuver for me to try to save it. But I told them straight up, I said, I don't know how long it's going to last, because I had to laser all the way around the gums. I had to remove some of the bone, something called crown lengthening. I had to do a lot of these things in order for me to try to save the tooth. Okay, but it's not really a good situation for you to be in. Okay, so come in every 6 months. All right. And this person that says GABA, I'm seeing this GABA Nana. She's saying, ain't no one got time for teeth right now. Everyone's got time for teeth. And she says, free Gaza. Yes, free Gaza. Who else got comments? No one's got comments. Okay. All right. Now, dental health is important. Okay. Your dental health is very important. And, part of the video, it says, can you risk it? My teeth feel fine. $800. No, your checkup doesn't cost $800. It doesn't. Okay. But if you wait for a long period of time, it's going to cost you more, because then you're going to need fillings. You're going to need more work. Right. So yes, it's going to cost $800, maybe even more. Okay. So come in every 6 months. And lastly, in that video, I really suggest you go see the video. Okay. Lastly, that video, the guy said, I didn't want fluoride. Now, why fluoride? Why do dentists recommend that you put fluoride on? Because it makes them more money? No, probably the cheapest thing. Okay. It doesn't make us more money, but it prevents you getting cavities, because when you apply varnish, which has 22.6 thousand, okay, 22,600 parts per million of fluoride in that varnish. That's a lot of fluoride that's going to strengthen your teeth. Now, what's the point of fluoride? Okay, let me give you an example. If you were to not put fluoride, it's basically like putting an egg into acid. Okay, it dissolves really fast. Now, if you coat that egg with like paint, right, you give it a protective coating, and you put that in acid, it's going to take a lot longer for the acid to actually penetrate through into the egg. Same thing with fluoride. What happens is that the structure, literally the structure, the outside structure of your tooth changes. It goes from fluoroapatite, I'm going to throw a big word at you, it goes from fluoroapatite to hydroxyapatite. Now, the difference is actually 10 times. You actually reduce your cavities by 10 times. 10 times. Okay, because the way that the pH or the acid is measured is based on a logarithmic scale. I hope I don't lose anyone. Is based on a logarithmic scale, which is a power of 10, right? So between, like, for instance, pH of 1 to 2, like, when someone, like, if you read a pH thing that says, how acidic is this, right? It says, this has a pH of 2. Okay, and says, okay, but this one, this has a pH of 3. So the difference between the 2 and 3 is tenfold. So the 2 has 10 times the amount of acidity as 3. So so the pH is based on a logarithmic scale. If I completely lost you, just know that fluoride helps your teeth from getting beaten up by acid by a factor of 10. It strengthens it by a factor of 10. Okay, so that's why we put fluoride. That's why we recommend fluoride. Now, if you say you don't want fluoride, no problem. No problem. That actually just, it increases your risk of getting cavities, which means then next time you come in, maybe we're gonna find a cavity, and then it's gonna cost you some dollars. Okay. Anyways, that's it for today. Thank you so much for joining. Thank you for paying attention. Go see your dentist every 6 months. And until next time, and as always, keep smiling. Good night.